Good afternoon, and thank you for inviting me again to share my results of this project, which is also part of my PhD thesis at QUT. So in this study, I'm focused on retraction time lag, which is defined as time from publication to retraction. And the idea is to go beyond the focus on biomedical sciences, which is like a main feature in the literature. I also want to study how RTL or retraction time lag differs across scientific disciplines and time, identify research teams' features that might influence differences in retraction time lag, and propose alternative quantitative methods to analyze the data. I analyzed a corpus of more than 7,000 retracted papers written in English and published between January 1989 and November 2021. The papers were extracted from Retraction Watch and Scopus, and I also use size metrics to identify the domains of the papers, the scientific domains of the papers. There is a potential issue with the Scopus because sometimes it replaces information about the paper with information from the retraction notice, in particular the date of publication. There is another issue, which is the high concentration of retracted papers. There are more than 600 outlets in the corpus, meaning journals and conference proceedings, but more than 50% of the retracted papers are published in only 10 outlets. That's why I decided to create 3 different corpus to check the robustness of my results, although in this presentation, I will show results that are common to all 3 corpora. The first finding is that the longest mean retraction time lag is for health sciences, which is about 23 months, which is 11 times more than the time it takes to retrain papers in the economic and social sciences, which is about 2 months, followed closely by applied sciences, for which it takes between 2 and 3 months. I also found different distributions of retraction time lags across the 4 domains, which are applied sciences, economic and social sciences, health sciences, and natural sciences. In this analysis, I exclude arts and humanities because there are only 18 papers in the corpus. I propose 4 econometric models. One is a log linear regression model, and I also propose 3 duration models. The first one is an accelerated failure time model, and 2 versions of the Cox proportional hazard model, with and without a frailty term. The model with frailty term is particularly important because it can capture the clustering nature of the data, in particular the journal or the conference proceeding in which the paper was published. I analyzed 2 different proxies for time. The first one is publication year, and I found that the later the publication year, the longer it takes to retract articles. This finding was consistent in 3 out of the 4 econometric models. However, for the frailty model, the result flipped, and I would like to check this result in the second phase of my research. The second proxy variable is the retraction year. In this case, I found that the later the retraction year, the longer it takes to retract articles, and this found is consistent across the 4 econometric models. I also found that the bigger the team, the longer it takes to retract the paper. Possibly it's because it's difficult to assign or deciding who is innocent and who is guilty in a big team. Another possibility is that the bigger the team, the stronger the defense front the research team can use to defend themselves. I also analyzed the research seniority of the researchers, defined as the time from publication of a first paper to publication of a retracted paper in the corpus. Most retracted papers include at least 1 co-author for whom the retracted paper is in fact the first publication. And in general, the mean retraction time lag for experienced teams is longer than those including at least 1 novice researcher. In this table, I'm showing the results for Corpus 1, but the results are consistent across all corpora. In the future, I would like to extend this research, including additional variables such as the journal quality, the gender of the researchers, institutional prestige, and I also want to check the interaction terms in the econometric models to improve basically the econometric analysis for this data set. Thank you very much, and I'm open for your questions if you have any.
So thanks for having me, and today I'm here to present a small part of my PhD project that started when we found a lot of errors, and we wanted to test whether PubPeer players contribute to the published corrections of flawed cancer research articles. So before we get into the question, a central feature or core component of cancer research is the study of genes. But genes themselves are essentially nucleotide sequences, and so we rely on reagents that are also nucleotide sequences to study them. But as you can see from the board, these reagents are not visually intuitive. And so and they're like barcodes, and so we often rely on an in-text descriptor that tells us what these reagents are. What we can do is we can use some bioinformatic techniques, nothing new, a lot of this we learn in undergrad biology, to fact check whether these sequences match the claimed descriptions. And in the case of a mismatch, we have an error. And we found a lot of these sequence errors in two high impact factor journals of molecular cancer and oncogene, and we published this work earlier this year. So these errors are concerning as methods that describe the use of wrongly identified sequences do not align with the results that are claimed to be produced by a particular manuscript, and thus could be a sign of questionable reproducibility. And furthermore, in this molecular research space, researchers like to reuse sequences across the published domain. And so not only will we see the propagation of unreliable results, but we could also see the propagation of incorrect reagents if left uncorrected, and thus implicate scientific progress, and thus lead to the waste of research funds, times, and resources that could culminate into the reducing of public trust in science. And so the simple sort of question here is, well, we need to get rid of these. So as we all know, most of the time we will reach to a journal and we would go through a horde exchange of emailing to get something corrected. Or alternatively, we can put things up on PubPeer, an online platform that encourages discussion amongst peers on published articles. And we hope for something to happen when a lot of people start commenting on a particular article via PubPeer. So the question is, well, does putting things up on PubPeer contribute to the published corrections of flawed cancer research articles? And so what we did was we selected articles that contained at least one wrongly identified sequence that was not corrected or retracted before January 2023 and wasn't previously reported by our colleagues in PubPeer. We then aligned each paper by ascending PubMed identifier and journal, flipped a coin and allocated the two papers into two arms and wrote up identically worded templated comments, as you can see in the figure there. So briefly, what we did was we first emailed the editors of the two journals on March of 2023. And then in April, we put up the first ARMA papers onto PubPeer as queries. And then 6 months later, we put up the second ARMA papers on PubPeer. We were supposed to wrap up the experiment at the April this year, but due to some delays in our manuscript being published in January that contained notices on all these errors, we eventually wrapped up the study at the end of July this year. So briefly, one paper was retracted before the ARM 1 PubPeer posts were up and thus excluded from analysis across both arms. And broadly, we could see an equal distribution of papers by publication year and journal across the two arms. In terms of the response rates that we observed as we put things up on PubPeer, across both arm 1 and 2, 29% and 21% respectively of the papers that were queried received a response from authors, and most of the authors responded within the first month of posting, with arm 2 being slightly more spread out. We also noticed that most of the authors of the papers that were published in 2020 responded on PubPeer than any of the other cohorts, and this was especially evident in papers that were published in molecular cancer during 2020 that were allocated in arm 1. So how did the journals fare over the period, to answer the question? So across arm 1, 3 papers that we put PubPeer queries for in terms of these sequence errors were corrected through formal correction notices, and all were published by Molecular Cancer in 2020 originally, and they all also had image errors noticed in tandem with sequence errors within the correction notices. And so comparatively, across arm 2, nothing much happened over the period of monitoring. So some limitations to consider. There are differences in how long we monitored both arms, and the numbers of molecular cancer versus oncogene papers that we analyzed. It's just what we found, as well as the observations are limited and not generalizable, as they are from 2 journals from the same publisher, but much of the experience anecdotally mirrors what we've all experienced. So in summary, to answer a question, not much is happening in terms of sequences, and this could be because there might be a lack of understanding of sequence errors, or it could be a reflection of just how difficult post-publication correction is. And so considering this disconnect, we definitely need to make PubPeer more translated into published corrections. Thank you.
Thank you for having me. So today I'm going to talk about a study I did last year at the University of Melbourne around how psychology journals handle post-publication critique. So why would we want to study published critiques? Well, we know that traditional peer review system isn't perfect and that many flawed papers still make it into print. But journals are in a privileged position where they can help correct the record by offering to publish critiques. In fact, this practice can even help shape science, as was demonstrated in 2011 when this controversial article, which claimed to have found evidence that people could predict the future, inspired this response, which is arguably the most famous example of a post-publication critique, because the authors here pointed out that the questionable methods used in the original article were actually common practice throughout psychology. And this led to widespread conversation around what we now know as the replication crisis. So for the purposes of our study, we kept a pretty strict definition of post-publication critique because we wanted to focus on journal accountability. And so for this reason, we only counted critical discourse when it was published in the same article, in the same journal as the article it was critiquing. And we had two populations of interest that we wanted to look at. So we were interested in all psychology journals in general. And then we also wanted to see how this functioned in just the most prominent psychology journals. And we needed two samples from each because we wanted to look at two different aspects. First, how journals handled the critiques, and then how often they actually appeared within the literature. So we randomly selected 100 journals from all psychology journals, and then we also ordered all the journals according to their impact factor and selected the top 100. Within all these journals, we looked to see whether there was any clear indication on their websites stating, yes, we are open to publishing critiques, and if they did, whether they imposed any limits such as word count or time to submit critiques after publication of the original article. For prevalence, similar thing, we selected 100 articles randomly from the entire psychology literature, and then another sample from just the prominent journals we'd identified. And within all these articles, we looked to find any links to or examples of post-publication critiques. All right, what did we find? So among the randomly selected journals, only 23 had any kind of clear indication of some kind of post-publication critique article type. This was slightly better when we looked at the prominent journals, going up to 38%, but still relatively low. And regarding limitations, while these often weren't stated, and when they were, they varied widely, the strictest limits we found were just 400 words in length in one journal, while another journal required that critiques be submitted within 4 weeks of the original article being published, which I'm sure you can appreciate as some pretty serious constraints if you're trying to write a thoughtful criticism of someone's work. All right, moving on to prevalence. So similar thing, we had our two samples, and among all 202 articles that we looked at, we found a grand total of, drum roll please, one single critique. Yeah, and here it is, kind of half hidden in the recommended articles, just as a little link there. In fact, we almost missed it due to researcher fatigue, so thank God for second coders. Right. Oh, and in case you're wondering whether or not a journal was a member of the Committee on Publication Ethics, didn't really appear to influence whether or not they had some kind of post-publication critique policy in place. And also, purely incidentally, during this study, we happened to notice 2 major journals that had removed post-publication critique formats and 3 major publishers which had disabled web comments on their site just in the last few years. So not great. To sum up, I think it's fair to say that psychology journals really need to do better in terms of publishing these critiques and fostering open critical discourse within science by offering to publish at least one format of post-publication critique, preferably with flexible length limits, ideally no time to submit limits, and these really should be clearly linked on the target articles so that anyone reading can be aware that there has been this discourse. And we hope that these kind of practices would encourage more open, constructive critical discourse within the published psychology literature. Finally, big thank you to everyone involved in this. And if anyone would like to learn more, we just released a preprint last week on SciArchive. Thank you.
I too am from the University of Melbourne, but there's no fewer than 6 other universities and 1 international university representing the investigator team. So it really is a cross-institutional piece of work. I'm going to talk to you today about using some AI tools to examine the trustworthiness of potentially problematic papers. So a recent review by John Carlyle found that 26% of papers submitted to anaesthesia presented data that lacked credibility so blatantly that they can be called zombie trials or zombies. And John Ioannidis said that it's likely that hundreds of thousands of these zombie RCTs haunt the medical literature. So the problem is that fabricated data from these zombie RCTs end up in meta-analyses, which feed through to clinical guidelines, and therefore people are influenced to use things in day-to-day practice that might be faulty. So the goal is to try to identify the zombie RCTs, get them retracted, and thus remove their influence. Zombie trials are characterised by telltale statistical signs. Here's a list of them. Data copying between tables in different studies. An example of that is on the right. Violations of Benford's law of leading digits. Implausible distributions of summary statistics, especially the work that John Carlyle has done on p-values from baseline comparisons. Overrepresentation of even numbers. And many of these papers have got piles of errors in the most basic calculations. So what we've got at the moment is a large volume of published RCTs that really can't be trusted. And papers with freshly fabricated data are being published at an alarming rate. So what we can already do is apply statistical methods to identify those potentially problematic RCTs. All of the telltale signs on the previous slide have been wrapped up into tools and techniques. There's plenty of published work and easily available material to do that. But done manually, this is time-consuming and labour-intensive, and many of those statistical methods only work with large volumes of papers. So what we want to do, and what we're hoping that the AI revolution can help us do, is to accelerate statistical learning by automating the extraction of tables containing data from PDFs and published RCTs, and then executing pre-written computing code to perform the integrity checks. We've been working with ChatGPT's 4.0, when most of the work has been done with that. Recently, we've been talking to representatives from IBM Australia about using their AI tool called Watson X, and we're hoping to start some experimental work with that soon. There's plenty of AI data extraction tools that claim to be able to pull tables out of PDFs, and we've had a diversity of experience trying to get them to reproduce tables that can be plugged into statistics packages. Here's an example of a conversation with ChatGPT 4.0. This is a retracted paper, Bardaway 2011. Put the PDF in, ask ChatGPT, can you extract the data, format as Excel tables? It says no problems. And then you've got to ask it to mark around with the percent signs, and for some of the tables include standard errors. But a short conversation can lead to reproducing the table at the top of this slide, which is the one from the paper, as the table in the bottom here, which is in Microsoft Excel, and you can knock yourself out by running your pre-written R program or in any other package or platform to implement your statistical analysis and any other integrity checks that you want to do. So ChatGPT does a pretty good job of reproducing tables of summary statistics, but it's only semi-automatic. It requires prompting from the user. And my colleague Tomasz Folzniak, who's a professor of computer science, been putting forward a student project, and he said of this project that the aim should be a web application that extracts tables from a PDF file, but the process is going to have to be interactive, and the user will have to be able to intervene at all steps. This is necessary because none of the tools are reliable enough to work with an arbitrary PDF file. So that is the goal, is to try to get a completely automated process for large volumes of papers. We've got to clear the backlog from the first 25 years of this century. We've got to expand to other fields of medicine. We work in obstetrics and gynecology. So we've heard before at this conference, a lot of work done in anesthesiology, but other fields of medicine could really do with our help. And last but not least, to avoid accusations of bias. We don't want to be targeting particular authors, groups of authors, institutions, or countries. It would be much better to just have a screening process for large volumes of published papers. So thank you for listening, and we'll continue to hunt.
Research relies upon public trust, and this is especially the case when we're doing research with human participants. We ask for bits of their literal bodies and some of their most personal information and just say, trust us, we're scientists, you know, we're doing this for the public good. And that is usually true. However, that doesn't give researchers unfettered license to do what they want with people's tissue and data. What the community is willing to accept as a reasonable trade-off for scientific advancement for the public good is not always what the researchers think it is, and this is what drives our research ethics systems. And so we have guidelines and laws that aim to constrain research, the conduct of research, to align with community expectations so that it's worthy of their trust and so that they can feel comfortable handing over their tissue and their data. The role of ethics committees is to assess whether the proposed research complies with those laws and those guidelines. But there are some problems with this in practice. There are more than 200 HRECs in Australia, and they all seem to apply the guidelines differently, and they sometimes apply additional requirements of somewhat uncertain origin. And this can make it really difficult for researchers to know how to go about designing their studies. And it causes particular issues for multi-site studies. As you can see from the Australian genomics example on the slide, inconsistencies both within and between HRECs can be immensely frustrating, wastes huge amounts of time and money, and may not even end up improving the quality of the resulting research. I'm not actually intending for this to be an ethics committee bashing session. I have been both a frustrated researcher and a frustrated HREC member, sometimes simultaneously. But on the whole, I think that ethics committees are doing a really great job with extremely limited resources and very little support from either their institutions or the NHMRC. In some ways, they are set up to fail. But the point remains that inconsistencies in the application of ethical standards raise questions about the quality of ethical review processes, particularly in relation to the quasi-legal decisions, such as the Section 95A waivers of consent. So what can we do about this? Well, as part of a bigger project that we're doing for the ARDC, we're running an ethics benchmarking exercise in which we're inviting all the HRECs to review a dummy application for secondary data sharing. In our fictional application, there will be some ambiguity about the scope of the original consent, which is extremely common in reality. So the HREC, first of all, has to decide if a waiver is required or not. And if yes, they have to apply the waiver guidelines under section 2.3.10 of the National Statement. Things like whether it would be impracticable to reconsent everybody, or whether the participants would be likely to say no if asked. We'll then analyse their review minutes and conduct post-review interviews, and we'll also interview consumers about their views of the dummy application. I would love to share findings with you, but I'm afraid the project hasn't made it through ethics yet. The idea, though, is to identify some gaps in HREC skills, in their knowledge and their resourcing, that we could conceivably plug them fairly easily. We also think that feeding back our findings to committees so that they know how their approach compares to everyone else's may have some value as well, and that the whole process may act as both a professional development and standardising exercise through benchmarking. Further, HRECs currently have no guidance on what consumer expectations are beyond that provided by the two lay people that have formed part of their committee. And they tend to become less lay the longer that they're on that committee, and so even that input is limited. And so this information will inform resources to help HRECs assess applications against the waiver criteria and in line with community expectations. Now, obviously, this study is limited in what it can achieve on its own, of course, and it's not going to fix all the problems with ethical review in one go. The primary purpose here is to contribute to the evidence base that will inform the development of resources for researchers and HRECs who are involved in data sharing. And that's the point of the ARDC project, which I should note is not research, even though it looks like research. But it also serves a secondary purpose here, which is to test the feasibility of benchmarking exercises like this for facilitating a flow of information between HRECs who are currently very isolated, and might contribute to improving the quality and/or the consistency of their decision making. in a low-cost way that can be easily extended to other types of ethics decisions, not just waivers of consent. And addressing the challenges that are facing research ethics, I mean, it will obviously have to be multifaceted, and it will require a more systemic approach, but this might be a productive first step. And just to finish, I'd like to acknowledge the whole team behind this work and the support of ARDC and CTIQ. Thank you.